I think we need to look across the spectrum. So I think across not only the neurodegenerative spectrum, but across the psychiatric spectrum. So we don't really know, for example, even if you talk about, early onset schizophrenia or early life depression, we don't really know the mechanisms of those disorders. And is there a link that would explain, for example, the symptoms across the spectrum? So I think we need to really focus on translating, if you will, whatever findings we have in psychiatry over to the neuropsychiatric spectrum and vice versa. I think they can inform each other. I think we need to understand how these symptoms bring on or an early manifestation of dementia. We need to understand what is it about neuropsychiatric symptoms that then leads to this, this cognitive decline in this cascade of neurodegeneration. So I think that's something we need to more fully understand. And then I think the third thing I think we need to more fully understand is what differentiates the subtypes. We have about 12 different types of neuropsychiatric symptoms, and we don't really understand the individual mechanisms, let alone the full mechanisms. The other, probably the fourth thing would be therapies and treatments. And I think that's an area that's obviously critical for everyone, is to identify or to develop some effective therapies and treatments that will help to ameliorate these symptoms. And I didn't mention genetics under mechanisms, but I probably should have. That's another, a whole other area that needs to be certainly looked at.